Hi all, thank you for joining me today. For those who don't know me, my name's Nicole Bortone and I'm the Senior Program Manager at the Ian Potter Foundation, responsible for managing our Early Childhood and Development program. Thank you for joining me today and bearing with us with our technical issues. I'm just going to pull up the slides now and we can make a start. Okay, hopefully you can all see that PowerPoint, and apologies for the technical issues. I'm navigating this on my own. Our comms manager's having trouble joining the session. As I mentioned, my name is Nicole Bortone. I'm the Senior Program Manager responsible for our Early Childhood Development program. And before we start, I'd like to acknowledge the Wurundjeri people of the Kulin Nation, who are the traditional custodians of this land of which I'm beaming to you from today. And I'd also like to pay my respects to the elders past, present and emerging, and to any Aboriginal and Torres Strait Islander people listening in today. Today's session is being recorded and will be available on our website next week, so please don't fret. If you miss anything, you can come back and rewatch later and share with other colleagues. The session will provide a brief overview about the program, our processes and priorities, and we'll have time for questions at the end. You're welcome to add questions to the question and answer box at any time throughout the presentation, and I'll answer as many questions as I can at the end. Please only use the chat box for technical assistance. Sarah Hearn, our Communications Manager, will hopefully join us soon and start moderating those chat boxes. So Foundation's Early Childhood Development Program is one of 5 program areas and sits under the FAIR pillar. In line with the evidence about the benefits of investing early, the program has been focused on early childhood development since 2016. And the aim of the program is to improve child development outcomes for children aged 0 to 8. And please see our website for the full objectives. The program area receives approximately 13% of the Foundation's overall funding, which is approximately 1.8 million annually, but this amount comprises existing commitments as well as new grants. This leaves a budget of about 600 to 800 each year for new grants, which only equates to about 4 to 6 each year. All proposals submitted must be over 100,000 and be over multiple years, and the average grant size is approximately 300,000 over 3 years with an upper limit of $1 million over 5 years. But we currently have 3 out of 34 grants of this size, and they are all with organisations with whom we have a previous relationship. So we're really looking to support organisations with that size of grant with whom we already have a good track record. The program area opens once a year to applications and it uses a 2-stage process. EOIs open this year on the 6th of March and close the 30th of March. Before submitting an EOI, all applicants are required to speak with the program manager or officer, and phone calls can be booked from our website opening next week. Each year we receive numerous inquiries. Last year we had 125 phone calls booked and awarded 4 grants. So it's a highly competitive round with a success rate of about 3% from phone call to full approval. So if I advise you that your program is not likely to be a priority, please take that advice on board. I'm trying to save you time and energy, and we know that the not-for-profit sector is time poor. Following an initial phone call, if encouraged, you can submit an EOI and it will either be invited to a full application or not. And the deadline for full applications this year is the 16th of June for a board decision in late September. So the process takes approximately 5 months from EOI submission to board decision. The process for universities is a little bit different. Applications submitted from universities must be processed through the Research or Advancement Office. And our expectation is that the advancement understands the Foundation's priorities in each program area and shortlists a maximum of 3 proposals per program area. Once the Advancement Office has completed shortlisting the top 3 or less proposals, they should book a time to speak with the program manager via our online booking system before being invited to submit an EOI. Given the limited funding available, the Foundation is looking for large-scale strategic projects that have potential for scale, sustainability and/or replication. We take a portfolio-style approach with our funding across the program, funding impact, capacity, momentum and innovation. Impact refers to research and sector support. Capacity refers to capacity building and leadership. Momentum looks to scale promising programs, and innovation refers to pilots and new resources and tools for families. Last year, we awarded 4 new grants totaling 2.5 million over 5 years through the open funding round, and they fell across these areas. I'd encourage you to please refer to our newsletters, grants database, and annual reports on the website to learn more about current and recent grants. We fund both universal and targeted programs and have a strong focus on evaluation. Please refer to our website for exclusions, both general and specific. Most importantly, we can only fund charities that have both DGR and TCC. If your organisation does not have either of these, you are ineligible. We're not interested in supporting in this program organisations to simply continue or add new programs, locations or staffing to their existing service offering. We really look to fund projects that extend beyond the one organisation. We're also not interested in supporting advocacy unless it relates directly to a program we are already supporting. And I would note that we are currently funding the Centre for Policy Development with a grant of $1 million over 5 years to support their early childhood development initiative. We also don't support traditional or pure research projects. We only fund translational research. And I see that there's quite a few university registrants here today. We also don't prioritise support for outreach and education programs from galleries, museums, zoos or universities, or arts, ethics and environmental education programs in schools and services. And that is not to say that these programs are not valuable, but they are not a priority in this program. Once submitted, all EOIs and full applications are assessed against our funding principles, which are collaboration, innovation, excellence, sustainability, potential for impact, and leverage. The more of these principles you can tick off with your application, the more likely you are to be competitive. I think the majority of these are fairly self-explanatory, but excellence really refers to, are you the best placed organisation to be leading this work? And in terms of potential for impact, we're really looking at the potential for ripple impact of the project, both in the short and long term. I'm just going to stop there because I just want to make sure that this is coming across. I'm just going to check the question and answers. Hopefully everyone's able to hear us today. Please put notes into the question and answer boxes if you're having trouble. Okay, perfect. Thank you for that, Kim. You're a lifesaver. We're still having issues technically. So a couple of tips and hints for you to do your research. Please look at our website and the objectives, exclusions, and in particular, our recent grants. If we're already supporting something similar, it's highly unlikely that we'll support another project in the same vein. For example, we're currently funding the playgroup network nationally with a grant of $1 million, along with a number of smaller supported playgroups in remote Indigenous communities. So we're not likely to support any more playgroups at this stage. Evaluation is very important to the foundation, so please consider it from the outset. In your application, we will ask you how you plan to assess both your short and long-term outcomes. Numbers matter, so please include figures in your proposals, how many schools, centres, children you're planning on targeting, and how many teachers you plan to train. This helps us to understand the scale of the program. Don't reinvent the wheel. If you're aware of similar programs to what you were proposing happening somewhere else, mention this and how you will connect or consult with other models. Our pet hate is seeing organisations doing the same thing in other states and not leveraging and or learning from one another. As I mentioned just now, we're currently funding Playgroup Network nationally, and Playgroup New South Wales was the lead from that application, with all the other states and territories providing letters of support and attending meetings before the application was submitted. That's just to show that it was a collective effort, and we really appreciate that in any applications that come through to us, as you would have seen in our funding principles. And the last point is self-explanatory: collaborate, collaborate, collaborate. We look at the number and quality of partners involved in all of our projects, and that is how we assess potential for impact. I'll walk you through a few examples now of current grants to help give you an illustration of what we're looking for. The first example is a $1 million grant we awarded to the Reach Hub at Melbourne University in 2021. This grant is to support a study called the EDGE study. The grant is over 5 years and will support Reach to evaluate the rollout of 3-year-old kindergarten in Victoria as it occurs. And there's a great video in our December newsletter if you want to learn more about the project. The project fits within our impact stream of funding and was awarded because it was highly collaborative with both the Victorian government and the Front project engaged. The study has significant potential for impact both in Victoria and other states, as it has strong Victorian state government support, and the findings from this study will not only inform ongoing delivery of 3-year-old kindergarten in Victoria, but also make the case for investment in other states with lessons for implementation. The study is designed to be translational from the outset, with the front project acting as a translation partner, regularly meeting with policymakers, regulators, and institutes across the country to share their project learnings. The grant provides excellent leverage for the foundation with an investment of $5.7 million from the Paul Ramsay Foundation and additional support from the Denny Leaper Foundation, alongside the Victorian Government's significant and ongoing investment in three-year-old kindergarten. The next example falls across the innovation and momentum streams. The foundation is providing Kids First with a grant of $750,000 over 5 years to implement and evaluate an adapted version of their evidence-based early years education program. The foundation was one of the original funders of this evidence-based program, and this project seeks to take the most successful elements of the program and apply them in universal settings. The program is preventative and takes a sensible approach to scaling a proven but highly expensive program. The grantee is partnering with MCRI to evaluate the program, and if it proves to be successful, they hope to scale the model beyond the pilot sites by developing a digital training package to offer early learning providers Australia-wide for a fee, as well as being a registered training provider on the Victorian School Readiness funding menu. The last example I'll give you today falls into our capacity stream. The Connection program has been operating since 2014 in schools and has a proven evidence base. This grant provides funding to SVA to adapt and pilot this community of practice in the early years sector, first targeting integrated child and family centres. The project is innovative and it responds to need. A number of reports and consultations have revealed that practitioners in these centres are wanting additional support and networks. The project is collaborative. SVA are working together with the Centre for Community Child Health at MCRI and integrating and complementing the work being undertaken as part of the National Child and Family Hubs network, which the foundation is also funding. Rather than just transplanting an existing model into a new sector, SVA are thoughtfully expanding and evolving the program into the early years, working with integrated child and family centres first, who have requested additional support to pilot the network, focusing on strengthening transitions and leadership. Now that's the end of the formal presentation, and now I'll leave time for questions. So I'll have a look over here at the questions and I'll take off the share screen. Hang on. Okay. So I can see a few raised hands and I'll jump into some of the questions. So what is the definition of a pure research project? Catherine has raised that question. Really, we're not supporting straight research. That's what we mean by pure research. If we're supporting a research project, it would be like the EDGE study that I mentioned, or creating resources and tools for the early years sector to use. Another example is we're currently funding the University of Western Australia to implement a child development atlas in Western Australia. And that's a great example of, we don't want to support research that just sits on a shelf. We're really looking at supporting projects that have translational impact considered from the outset. When do applications close? I think I put the deadline, it's on our website, but I think it's the 30th or 31st of March for EOIs. Someone else has raised the question as to eligibility on museums and galleries. So we do, in other programs, support outreach programs for museum and galleries. We're also currently supporting the Song Room, for example, and Cool Australia. But the aim of the Early Childhood Development program is child development. We're not looking to support curriculum-based programs. Hopefully that addresses that question. And the last question I can see here is that someone has asked about sustainability. Sustainability, I guess, is a loose term that we use. It's not necessarily is the program ongoing, but if, for example, we're funding a translational research project, we would want to see that scaled or informing another program that comes out of it. We don't want to support work that goes nowhere, essentially. We're really looking at supporting projects that have a significant potential and ripple impact. Someone's asked if an organisation can apply for multiple program areas. Yes, that's correct. You can apply for early childhood development, community wellbeing. They're both open at the moment. But I would make the point that both community wellbeing and early childhood development come out of the same budget. So it would be considered, we would be looking at both, I guess, projects in parallel or competition with each other. Universities obviously are the exception to that rule. We accept a maximum of 3 from each university per program area. Across all our funds, all our programs, funds are tight. So if you're putting in multiple requests, we really want to be looking at, okay, well, what is really the biggest priority for the organisation? And we'll be expecting you to do that work before submitting. Anna's asked, would the foundation be interested in funding an evaluation of an early childhood development program that's offered at one organisation? Probably not, to be honest. So as you would have seen in the exclusions a little bit earlier, we're really looking at supporting projects that go beyond the one organisation. So that example with Kids First that I spoke about earlier, yes, it's a model that they're piloting initially at their 4 centres. But like they've done with the early years education program, the intention is to develop a model that can be scaled to other not-for-profits across the country. It's not an IP that they want to hold just within that organisation. Someone's asked, Sarika's asked, how much of scale is large scale? So as I mentioned, we support both targeted and universal programs. So we look at statewide, nationwide. We also look at really targeted programs in remote communities. We're currently supporting a number of grants up in the top of Kimberley. We're supporting World Vision Australia and Kanyanipa to deliver supporter playgroups in a number of communities up there. So we do support targeted as well as universal, but we're really looking at programs that have the potential to be sustained. Our, I guess, biggest bugbear is funding something that disappears away. So when you're submitting an application, we really want you to be thinking about what's next beyond the life of the grant. Tanya's asked if we look at perinatal and projects. Yes, we do. I would make mention, though, that we also have a public health research program. So for program, I would have a look at the objectives of both program areas and consider where it best fits. But yes, we define 0 as antenatal or prenatal as well. Julia's asked regarding pilot programs, can you apply to build on an existing pilot program? Yes, in a sense, but we would be looking at, what kind of funding you're offering, what are you proposing is different to what you're already doing. So we don't want to just be filling a gap with our funding. So it's really about taking it to that next level. So I mentioned that we have a momentum stream. That's really about using, building on an existing pilot or an existing resource and making it, I guess, sustainable or scaling it so that it is sustained long-term. That's what we sort of mean. So it wouldn't be just phase 2 of a pilot doing more research. It's really on, okay, how do we get it to be sustainable or scaled, bringing it to that next level? And that's what we sort of mean when we talk about momentum. Brent's asked, how do we book a call with you? Our booking for phone calls will be opening up on our website as of next week, I believe. So check back in a week's time and we should have this recording up there along with the booking system will be live, so you can book in a time. And generally phone calls go for about 15 minutes. For universities, they're a little bit longer because we're expecting to speak with the advancement or research office so that they can walk us through their sort of top 3 projects. Anna's asked, will be interested in funding the expansion of a project currently in WA to other Australian states. That's probably something that we've been to chat about over the phone. We don't generally just support the expansion of existing programs into other locations. So yeah, I mean, that would be, I guess, I'd have to learn more about the project itself and we can discuss that over the phone if you want to book a time. But generally, no, we don't support a project that's happening in the Pilbara and then being transferred to another site. That's not an interest. It's not innovation in our mind. But I guess if it fell into that momentum category, that it's sustainable in WA, we want to also expand into South Australia. And this is why we believe it will be sustainable in South Australia, then that's a discussion that we can have. Megan's asked that whether Oh, okay, so Megan's asking about whether grantees can hold multiple grants. Technically, yes, I would discourage applicants from putting in, except for universities, multiple proposals into the one program. But if you have a current active grant, you can technically apply again, but you would need to make a strong case as to why you're asking for more funding. I mean, essentially, as I mentioned, there are limited funds. We're probably going to be able to award, between 4 and 6 grants this year. And if you're already getting money out of the pot, you need to really make a strong case as to why you're asking for more. Ernesta's asked, will we fund a trial that is scalable? So a trial in the first year and then scale over the next 2 years? Yes, we would. So a lot of projects that come to us are staged. So the first year might be the proof of concept, and then it might be scaling to more communities. A number of our projects are structured in that way, and we're very happy to look at applications that take that approach. I would encourage all applicants to think about multi-year proposals. We don't generally award any single year grants anymore. Most of our grants are on an average 3 years up to 5 years. Philippa has asked whether collaborations with government departments and agencies are acceptable. Absolutely. As you would have seen with a few of those examples just referenced, a lot of our projects are collaborative with government, and we really like to see them engaged from the get-go, particularly if they're sort of the end game stakeholder, if they're who you're hoping will sustain the program ongoing. Catherine's just asked about university submissions, whether you work with the research office first. Yes, that's correct. So as you can go back and look through the slides, but when working with universities, we deal initially with the advancement or research office, and each university has a different lead, but we work with them to prioritise a top 3 list maximum. I mean, we've even encouraged less than that to come through, because we're really looking at strategic projects with significant potential for impact. Mandy's asked if you can have an international collaborator on the project. Yes, you can. The foundation, as I mentioned, can only fund DGR and TCC organisations based in Australia. So the project itself has to take place in Australia, but we're very happy for international collaborators to be involved. Kate's asked whether we're going to answer some of the questions from the initial registration. Yes, we can go through some of those. So one of the questions was a not-for-profit early childhood provider wanting to deliver more programs. If they don't extend beyond your organisation, that would not be of interest to us. So as I said, we're really looking at projects that extend beyond the one organisation. If you're piloting a new model that you will then train a number of other services to deliver, then great, we'd love to see that. Or, if you're a service organisation working with children that are hearing impaired, are you collaborating with many of the other organisations across the country? Or are you developing something that will be only your IP? Essentially, if we would not consider a request that's only supporting the one organisation and their clients or their stakeholders. It really needs to extend beyond that one organisation. We're really trying to get the biggest bang for our buck with our limited dollars. Some of the other questions around multiple applications, I think I've already addressed that. Someone's asked whether we would fund new childcare facilities. No, we don't. So we don't fund new centres or services. That's not an interest of the foundation. We're really looking at strategic projects. So as I said, we receive numerous inquiries each year. We're not interested in funding new centres or services. It doesn't fall within our priorities. Someone else has asked, what's the upper limit? As I said, the average grant size is 300K over 3 years. And we will consider up to $1 million over 5 years, but we would really want to have a strong relationship with that organisation already if we're looking at that size of grant, and we would want to be expecting to see leverage. So I think the key thing, if you take nothing else away from today's session, is going through your proposal, but have a look at our funding principles, because both at EOI stage and full application stage, we're really assessing your proposal against those principles, and the more items that you can tick off or meet strongly, then the more likely you are to be competitive. Another applicant's asked about working in preterm birth. Again, that's something that a research project in that space could potentially fit in either our public health research project program or our early childhood development program, and we can have that discussion over the phone, but technically you would be eligible for consideration. It would be within our guidelines. Kim's asked whether you can start in 3 LGAs and then scale up. Absolutely. So as I said, we do look at innovation and pilot projects, but we would be wanting you to have an idea as, okay, well, you're going to pilot for 1 or 2 years or 3 years in 3 communities, but then beyond that, how do you, one, intend to sustain the program in those 3 communities, but also scale beyond those 3 communities once the proof of concept has been proven? Georgie's asked, will we support ethics classes for children at school? No. So we don't support curriculum-based programs, whether it's arts, environmental, or ethics, or social programs. We're really looking at improving early childhood development, and that's the focus of the program. Someone else has asked whether there's a minimum cash in kind contribution expected. No, there isn't technically, but obviously it would be considered favourably if you are contributing in cash, particularly if you're applying through university. Leverage is one of our funding principles, not just an in-kind contribution from the university or the not-for-profit applying, but also contributions from other funders, corporates, whoever might be supporting the project also. At the end of the day, we look at, as I said, those funding principles, and if the EDGE study is going to give us leverage of 5.7 million from Paul Ramsay Foundation, on top of the significant investment from the Victorian state government into the rollout of 3-year-old kindergarten, that has a significant potential for impact versus another project that has limited funding. That's sort of how we consider the proposals that come to us, and hopefully that answers that question a little bit. Capital works is another question. No, we don't fund capital works. So new centres, capital works, services, they're not an interest of the foundation. We just simply don't have the funds to fund those types of projects. It seems like that might be all the questions, I think, unless there are no more. Callie's just asked, if we don't fund new centres, how will we fund a new model? So we're funding a program in services. So, for example, with that Kids First program I mentioned earlier, they're an existing service. They're piloting a new model within that service that they will then scale across all their services and then provide training to other services across the country to take on board that model. We don't fund centres. We see that as a responsibility of government, essentially, to be funding new services, and we simply don't have the funds to fund service delivery. Do we look at programs for children with a disability? Yes, we do. So if you have a look at our website, you'll see the grants that we awarded last year. We supported an organisation called Reimagine to build on an app that they've developed called Thrivery that provides a resource for parents of children with a disability or developmental delay. So we do consider programs in that space, but we don't support therapeutic programs, if that makes sense. So, or service delivery, I guess, is probably a better way of describing it. Kim's asked a question about how favourable it is to target AEDC results. It depends on the nature of the project, I would say, but yes, some projects are looking to target AEDC results. We used to use that, I guess, as a universal measure, but it really depends on the nature of the project. But as I mentioned, evaluation is something that the foundation really prides itself on. We have a strong evaluation focus as an organisation and have for quite some time. So we're really looking at, any project that comes to us, how are you planning on proving it's impactful? So we'll be wanting you to think about whether that's a population level measure or you have your own measures as part of the project. But we're really looking at, I guess, child development is the aim of the project. So of our program. So how are you planning on measure your outcomes against that? I think that might be all of the questions. So thank you everyone for your time today. I know that it's been a busy start to the year, so I really appreciate you coming on for 40 minutes to listen to us and bearing with all the technical issues. And I look forward to chatting with many of you over the next few weeks.